today and discussing senior home safety. So without further ado, I'm going to go ahead and turn it over to her here shortly. Keep in mind at the end of her presentation, we're going to have a survey. I'll talk about it at the end as well, but it's an opportunity for you to tell us what you thought of the presentation and request any information for future follow-up or future presentations. So please keep in mind questions that you might have. And at all, just like Mariah said during the presentation, if you have any questions, please feel free to pop them in the chat box and we'll make sure that your questions get addressed throughout. So take it away, Melissa.
Okay, hello everybody. My name is Melissa Swiontek and I'm an occupational therapist, senior home safety specialist, and a healthcare advocate, as well as a member of the Portland Elder Care Council. I've worked as an occupational therapist for 20 years. The past 15 years have been here in Portland in the home health industry. And recently I've started my own occupational therapy and private healthcare advocacy company. We're going to keep you guys, We're going to keep you guys muted, but please feel free to put in the chat or interrupt if you have a question. I will also stop throughout for questions as well. So today we are here to talk about how we can help prevent traumatic falls that can lead to hospitalizations and nursing home living. Falls can lead to injuries that make everyday activities challenging. In some cases, just the anxiety of having a fall can lead people to cut back on activities that they can physically and mentally are capable of doing. This inactivity then further raises the risk of falling. Staying active in a safe way keeps us physically fit and engaged in life. Although falls are the leading cause of injury and accidental death in older adults, they can be prevented. By taking control of your health and utilizing the resources available to you, you can reduce your risk of falls and continue to do the things that you enjoy. Many older adults are electing to stay in their homes and age in place though sometimes this choice is taken away when a fall happens and safety issues prevail. Through professional fall prevention training, aging in place safely has a much higher success rate. So I commend you all today for being here. You're not alone in your efforts to manage your fall risk. Occupational therapists, physical therapists, healthcare providers, and many people in your community are dedicated to supporting your health and well-being, but you are the leader of your fall prevention team. So today we're here to help you gain the knowledge to lead your healthcare team to reduce your risk of falls. Specifically, by the end of this presentation, you will be able to recognize that most falls among older adults result from interacting risk factors. You'll be able to describe how healthcare practitioners can help you reduce your risk of falls, and you'll be able to identify strategies and resources that you can use to reduce your risk for falls. 1 in 4 Americans age 65 and up falls each year. Every 11 seconds, an older adult is treated in the emergency room for a fall, and every 19 minutes, an older adult dies from a fall. Falls result in more than 2.8 million injuries treated in emergency departments annually, including over 800,000 hospitalizations and more than 27,000 deaths. In 2015, the total cost of fall injuries was $50 billion. Medicare and Medicaid shoulder 75% of these costs. A fall may be the first indicator of an acute problem, such as a cardiac arrhythmia or a urinary tract infection, or a fall may indicate a progression or onset of a chronic condition, such as Parkinson's disease or multiple sclerosis. It may be related to changes in your medication or medications interacting together, or it may simply be the signal of an onset of an age-related change in your body, like a vision change. Of course, sometimes falls just happen due to accidents, but in most cases, falls experienced by older adults are caused by several risk factors coming together and interacting. So let's take a close look at the 3 risk factor categories for falls. We've got physical, behavioral, and environmental. Sorry, my mouse is a little touchy. And my mouse has stopped. Hey, Bess, are you able to change the slides?
Yeah, give me just a second to pull it up here. If you want to
Not
talk a little
sure. Oh, well, I might have it now. Sorry about that.
You got it?
Yeah, I'm not sure what happened there. Sorry. So physical risk factors, we've got 3 categories. Our physical risk factors are the ones that are related to changes in your body that increase your risk for a fall. Impaired balance is an example of a physical risk factor. Behavioral risk factors are the things that we do or don't do. Sorry about that. The behavioral risk factors are the things that we do or don't do that increase our fall risk. For example, not asking for help when doing something that might cause a fall is a behavioral risk factor. And environmental risk factors are typically the hazards in our home or community, such as loose throw rugs or unclear pathways, or even pets in the way. So if we start with the physical risk factors, these include medications, dehydration, vision loss, decreased foot sensation, vestibular system issues, balance, strength, and endurance deficits, and the chronic illnesses. So we're going to break these down a little bit more. The medications can cause physical risk factors as known side effects. They can also interact with other medications that you might be taking, which compound the severity of the side effect or create a different unwanted side effect. Orthostatic hypotension is a good example. Orthostatic hypotension is also known as postural hypotension, or your blood pressure changing and dropping with changing your body position. So lying down in bed, your blood kind of swooshes back and forth along its path, nice and easy, and it doesn't have to fight against gravity. But the moment your feet hit the floor, gravity starts to take place and it pulls the blood down. Your valves have to start working immediately to work. They have to work harder in order to push that blood back up against gravity and get the blood back to your heart. And then you stand up and the valve motors aren't pushing as fast as they should still. And this creates your blood pressure to further drop. And now you find yourself in a precarious situation. You're in the middle of the room and your vision is growing darker, sounds are diminishing, and you're about to pass out. This is orthostatic hypotension, or your blood pressure dropping with postural changes. It's quite common as a side effect or interaction of many medications, and it's also a major side effect of dehydration. If you have issues with this, you should slow your transitional movements from lying to sitting or sitting to standing. Drink plenty of fluids and pump your ankles before standing. So toes up, toes down, squeezing your toes up, toes towards your nose, I'd say about 10 times before you stand. Another major consideration for physical risk factors are urinary tract infections, or UTIs. There are many reasons why these become more prevalent later in life, including decreased ability for proper hygiene and lack of proper hydration. Many times in home health, I would meet clients who had a recent fall, and the first thing we discussed was their urine and needing to rule out a UTI. UTIs lead to weakness, confusion, and falls in the older adult, and not all experience the burning symptoms that is typically associated with UTIs. So both of these issues tie into hydration, but how much exactly should we be drinking? We get that question a lot. This is really best to ask your doctor, because for certain kidney and cardiac clients, there are fluid restrictions which create a delicate balance when trying to manage hydration. Overall, the recommended amount of water generally is 56 to 64 fluid ounces of water daily, or 7 to 8 glasses for older adults. Diuretics such as alcohol and caffeine do not count towards this fluid intake minimal. And I can't stress enough to you that this is a key component in many clients' health issues. Less mobility means difficulty getting up to go to the bathroom, so clients decide to drink less water, and that kind of creates that vicious cycle. Your best bet is to stay hydrated. Our vision also plays a vital role in fall prevention. Vision checks need to be done annually, even if you have no history of vision loss, and more frequently if you have vision issues. Having proper glasses and light levels in your home for your specific vision issues are key in fall prevention. So earlier I mentioned your vestibular system. 50% of falls in the elderly can be attributed to a vestibular dysfunction. And feel free to jump in at the end of this slide too. I know this one can be a confusing one. But your vestibular system is your sensory apparatus of the inner ear. And this helps your body to maintain its postural equilibrium. The information furnished here is essential for coordinating the position of the head and movement of the eyes. It helps your body process movement and allows us to orient ourselves in space, even though we may be moving. We can keep our balance while turning or spinning around, and we know we are moving up in an elevator even though we can't see it. This system is also the source of true vertigo. There are minuscule crystals of calcium carbonate, or they're called otoconia, or even more generally, you can call them crystals. And they're normally embedded in the base of those semicircular canals over there in the purple. There's 3 semicircular canals. Sometimes if these crystals get loose, either by a hard hit to the head, possibly from a fall, or even more commonly with no rationale at all, these crystals will come up into the semicircular canals and start floating around. And these semicircular canals are basically like a hollow piece of spaghetti filled with a more thick or viscous fluid comparable to olive oil. So if the crystals become dislodged and start migrating up into one of these 3 fluid-filled canals where they're not supposed to be, it creates an intense feeling of the world spinning when you turn your head or change your position. This is called a Bppv, or benign paroxysmal positional vertigo. Most people just call it vertigo. And this actually happened to my husband a few times. Once after a heavy day of swimming in the pool with the kids and doing flips, and another time with no apparent reason. Having a Bppv once means that you're more likely to have it again. And the first time it happened, I hadn't yet been trained in this, so I sent him to the doctor, who proceeded to tell him that nothing was wrong. He just had a low heart rate from being physically fit. And I was a little frustrated with that because that solved nothing. And it took him a week for it to go away enough for him even to feel safe driving again. The second time it happened, I had been trained and I was able to fix him myself. In an older adult, though, this is an acute issue, and it requires immediate attention from your doctor or in the emergency room, as there is a positional movement. Actually, it's a maneuver that can be performed on you to put these crystals back in place. Vertigo not only causes balance issues, but it can also create nausea and vomiting, similar to motion sickness. This easily can cause falls in a person with no previous balance issues. It's usually a feeling of the world spinning around you, or sometimes clients have described this as their head feels like a record player. Furthermore, this system deteriorates through lack of use as we age. So when we're young, we do somersaults and spins and cartwheels, and we ride tilt-a-whirls, and it doesn't make us sick. And we provide that system with lots of stimulation. But when we're older, this movement's not quite as enticing, and we slowly start moving more rigidly. We do less somersaults and cartwheels, and eventually we're predominantly just moving forward and maybe a little bit of backwards. Without head maneuvers and stimulation of this system, we start to see difficulty maintaining our balance with our eyes closed or in low light situations. This is a good reason to talk to your doctor or therapist about vestibular uptraining exercises that you can safely do at home. Any questions there? We'll keep moving on if not. Yes, I see from Nora the Epley maneuvers, what can be done. She's had that experience before. Yeah, anyone who's had it before, it can be really difficult and scary, but it's kind of cool to know that it can be fixed too. So moving on with the physical risk factors, this includes lack of foot sensation. This is a side effect of some disease processes, especially diabetes and peripheral vascular disease. Even a mild loss of sensation in your feet can cause massive fall risks and often goes undetected. Many people do not realize the severity of loss of protection sensations in their feet, and they should have an easy monofilament test done. This is a monofilament. Not sure if you can even see it. It's really tiny. Maybe if I put my hand behind it. But basically all we do is we touch the bottom of the feet in 5 specific places. And if they can tell us without seeing it, without looking at it, if they can tell us that they can feel it, then we know their sensation is good. But many people cannot or lose that sensation. Our balance, strength, and endurance certainly impacts our fall risk as well. The more fit we are, the better chances we have to avoid falls and catastrophe. As we all know, it's very important to make the choice to stay active later in life when we don't have as many responsibilities that mandate us to be active. Chronic illnesses also have a major impact on our fall risk. These ongoing illnesses tend to host side effects of decreased mobility, decreased endurance, and pain. Pain above a 3 out of 10 threshold significantly impacts our fall risk. These also accompany cardiac and respiratory issues that can cause difficulties with our endurance and ability to safely manage our daily tasks. Stubbs conducted a study and they proved that community dwelling older adults with pain were more likely to have fallen in the past 12 months and to fall again in the future. Foot and chronic pain were particularly strong factors for falls, and clinicians were then told that they should be routinely inquiring about these symptoms when completing a fall risk assessment. So moving on to our second set of fall risk factors, behavioral. This is using good judgment and determining safe behaviors for us to perform. Our choice of what we put into our bodies also influences our fall risk, especially in regards to alcohol, diet, and again, hydration. Sorry, my mouse is so touchy. There we go. So first we need to choose behaviors wisely. Should we be attempting a backflip off of a roof into a pool? Nope, no one should. Some do, but no one should. Should we be carrying bulky items down the stairs? For some of us, this might be safer than for others of us. Determining where we land on each of these spectrums of safety with each task is really important. We can then discuss if the task can be altered and if a more safe solution exists. It's important to stop before an activity, consider whether or not it is safe, and make a plan that reduces your risk of a fall. Other choices we make include if we drink alcohol or not. We know this impairs our balance, so moderation is key. We choose to fill our bellies with vegetables and fruit or processed and fried foods. These all correlate back to our overall health and our ability to prevent falls. Drinking water and staying properly hydrated is usually our choice. We may know it's best for us, but do we really want to get up and have to go to the bathroom all the time? Again, dehydration is a risky player that leads to urinary tract infections and orthostatic hypotension, among other issues. Some helpful hints with improving your hydration. Determine what you like to drink best and always have it with you. Do you drink more if you have ice or no ice, straws or no straw, lukewarm water versus frigid water, flavored water, sparkling water, spring water? Do you drink more out of a specific cup or hydro flask or bottle of water? Determining that best style of cup is also really important for older adults. Our third risk factor section is environmental risk factors. This is OT's favorite part. A thorough home safety evaluation is recommended of your environment to help adjust preventable risk factors. The difficulty here is that this should be done before a tragedy, before the fall, which led to the broken hip, which led to not being able to return home because the house isn't wheelchair accessible. By having your home inspected by a professional, such as an occupational therapist, and following the recommendations for modifications, many falls can be avoided. Don't wait until it's too late and you have that fall in the shower or slip down the steps. Be proactive in your health and come up with a plan today on how to help keep you and your loved ones fall free. Unfortunately, this is often not covered by insurances until after the tragedy has happened, so seeking the service out ahead of time is key to preventing falls. We have two types of environments that are evaluated in a home safety evaluation: the actual environment and the created environment. The actual environment is your home setup, including entry, stairs, lighting, and handrails. The created environment is your belongings and what you do with those belongings. This includes clutter, throw rugs, cords, lack of organization, cleanliness, and even our beloved pets. So starting with the actual environment, first off, there is almost nothing that cannot be remodeled or altered in a home to make it more safe for aging in place. But what about the cost? For most, spending money on aging in place modifications to prevent injury is very difficult to think about. However, if you consider this, hospital treatment costs for a senior who has fallen is typically $30,000 to $45,000. And yes, insurance is going to help with this, but typical costs for assisted living facilities, if you can't return home after that fall, start at $4,000 minimal a month or $48,000 annually. And this is not covered under standard health insurance plans. Only long-term care plans or some facilities accept Medicaid if you qualify with low income. If you add costs up, you can see that by remodeling your home and preventing falls, it's actually cheaper than the risk of falling and requiring a higher level of care. Things that are examined in a home safety assessment of the actual environment are adequate lighting and preferably layered lighting, which means the lighting is coming from different sources. Low threshold at all entries and at every door opening in the home. Walkways, sidewalks, driveways, and entryways are all inspected for safety. The floors should be non-slip surfaces. Some of the new luxury vinyl plank surfaces are quite slippery if they aren't textured. Grab bars are the new seat belts. Grab bars should be installed in specific locations and for specific purposes that are individual to the client. Grab bars have been proven to save lives, just like seat belts. I also like to inspect all the surface heights of seats that the client sits on, including chairs, beds, and toilets for safe transfer on and off throughout the house. And it's also very important to add a personal emergency response system, or what we call a PERS. All seniors who are at risk for falls should have a PERS in place to call for help or to detect a fall. Some seniors who fall may not be injured severely, but may lack the ability to get up, and laying on the floor for days can cause a much more severe issue. Bathroom remodels can include a walk-in shower, handicap height toilet, grab bars, appropriate durable medical equipment such as raised toilet seats, bedside commodes, shower chairs, or tub transfer benches. As in all home modifications, there are options for more cost-effective equipment versus a full remodel, and often occupational therapists are the expert to help guide you in this domain. You can open up spaces and door frames to make your home wheelchair accessible, eliminating need for stairs by either having a bedroom or full bath on the main level if needed, or installing a stair lift and elevator system. Ramps can be installed at entries to homes, and there are builders who specialize in helping seniors remodel their homes for aging in place. They're called CAPS, or Certified Aging in Place Specialists. Your created environment is what you have chosen to do with your belongings. So this includes how you arrange your furniture, where you store your pots and pans, and where you keep your daily used items. Obviously, we've heard to remove throw rugs, but sometimes these serve a purpose that you need a throw rug. And in that case, finding the right type of rug is crucial. Is your home cluttered or organized? Are there open walkways or are there items spilling into the walkways? Is the home clean or is there debris on the floor? Outside, is the lawn and walkway cared for, or have fallen branches obstructed paths and are fallen leaves hiding the cracks in the sidewalks and driveways? Do you have a table by your front entry outside to have packages delivered so you don't have to bend all the way to the ground to retrieve them? And do your blankets hang over the bed and spill onto the floor at night, causing a trip hazard? Any questions yet? Looks like you guys are still awake. That's good. So we've got a case study here. So as an example, we're going to look at how these risk factors work in combination to increase fall risk. So let's take a look at this picture. Let's look for some risk factors. What environmental and behavioral risk factors might put this woman at risk for a fall? Feel free to just shout them out if you want, if you know any.
The stool that she's standing on.
What's that?
The stool that she's standing on.
Right. I think that stool is even one of those ones that looks like it rotates around. Anybody else got an environmental risk factor?
Oh, the vacuum right there. You know, if she does fall, she's going to hit that.
She's going to hit the vacuum if she falls?
Yeah.
Yep.
There's some items way up high that they should maybe put those lower, eh?
Yeah, that's right. So environmental, what about what's she wearing?
I was gonna say wearing flip-flops. I can't tell if they're flip-flops or just slippers, but not
Yeah,
safe footwear.
She does. She has flip-flops on, and she's got a robe on that is untied and could get tangled up in something.
A throw rug.
Yep, she's got a rug there as well. So the stool's not stable, her rug. What about behavioral? Jason mentioned, you know, it's kind of a behavioral choice that she has these things way up top here. So, you know, a behavioral thing could be that she could have organized her kitchen so that these items that she needs are within reach. Right?
Or having a safer step stool to use.
Definitely. We're not having the vacuum cleaner right next to her there. Exactly. So
And
she could have planned to
being a little stubborn, doing this on her own instead of asking somebody else.
Exactly. Exactly. So she could have planned ahead and asked someone to help. First thing her daughter will say if she finds her on the floor, Mom, why didn't you ask me? I would have taken that down for you last time I was here. Right? So all those things are involved in her choices there. So here's kind of recap of what we just came up with there, right? So it's important to remember that the risk of falling increases with the number of risk factors present. It might be difficult to get rid of all of our risk factors, but a little bit can go a long way because even small changes can make a big difference. Consider this tower analogy. Imagine you're building a tower of bricks with one brick stacked on the next. Each brick represents one risk factor. As the tower gets taller, it becomes more unstable. Likewise, when your risk factors stack up, your risk of falling increases. The goal is to shrink the tower. We might always have some bricks or risk factors, especially since some risk factors, like having already fallen or getting older, those can't be changed, but we can shrink the tower and therefore reduce our risk for falls. Okay, we've got one more case study here. So this is Terry. We're going to get a little more information on Terry. He's a 71-year-old man who works part-time at a local home improvement store. He is overall in good health, and he's always considered himself to be athletic since he was a star baseball player in high school. About 5 years ago, he developed diabetes, and because of his diabetes, he has some tingling and numbness in his feet. Recently, Terry was at home after a Sunday afternoon get-together with neighbors in his backyard, and he fell when he was cleaning up after the party. He was carrying a lawn chair down the steps to his basement. He lost his footing on the last step and fell. He fractured his right wrist, and he was referred to occupational therapy by his doctor right after the cast came off because his wrist and fingers were stiff and swollen. This doctor also knew that an occupational therapist could help prevent a future fall. Terry saw his occupational therapist, Kate, in an outpatient clinic. After asking Terry some pointed questions about how he was managing his diabetes, Kate learned that Terry was taking insulin and several over-the-counter medications, but he was not taking the medications consistently as directed. Kate explained that it's not unusual for a person to use many different types of over-the-counter and prescription medications. However, these medications can interact and create health problems that increase fall risk, especially if not taken as directed. Therefore, Kate told Terry that speaking with his doctor or pharmacist about his medication was an essential step to reduce his fall risk. Kate also explained the importance of staying hydrated since medications can reduce your hydration level, and that can lead to dizziness, confusion, or falls. So medications are one of Terry's physical risk factors, but what are some other of his physical risk factors that we can also identify? Anybody got any?
Not carrying, holding the railing going downstairs is important, or upstairs.
Right, it certainly is. That would probably be an environmental risk factor. Yep. So if we talk about, and we'll talk about the environmental risk factors too, if we talk about the physical risk factors that he has, we already talked about the medication there, but he's also got the diabetes, some balance, and he was wearing glasses. So after observing Terry perform several tasks while he was in the clinic and through administering a balance assessment, Terry confirmed what Kate witnessed. He was not as steady on his feet as he used to be. Kate suspected that Terry's peripheral neuropathy, which is the nerve condition that causes tingling and numbness in your feet, that played a role in his fall. She immediately contacted Terry's doctor to suggest that Terry attend a diabetes management program in her hospital. And this further led to a discussion about balance. Kate told Terry that a person can improve balance at any age. She provided him with balance exercises that he could do at home and ideas of how he could safely build balance skills. Kate also told Terry about community-based exercise programs such as Tai Chi. Terry made a promise to Kate that he would check out his schedule at the YMCA and contact his doctor to be sure it was safe for him to attend. Kate also let Terry know that many of these balance and exercise options can be found for free online and easily done in the comfort of your own home, which is especially relevant now to COVID. Another physical risk factor is his vision, and vision issues often accompany diabetes. Terry acknowledged that he had not had his eyes checked in 3 years, and Kate explained that diabetes can affect vision, and she told Terry that by having a regular eye exam and working with his eye doctor, he could take steps to preserve his vision. She went on to say that exercise and sleep are also important to eye health and emphasized that the key is to see the eye doctor on a regular basis. Terry agreed he needed to see his eye doctor. He wrote it on his calendar to make an appointment when he got home. Because of Terry's potential vision issues, Kate stressed to Terry the importance of having adequate lighting within reach throughout Terry's house. Terry mentioned that he sometimes struggles to reach overhead lights in his living room, and Kate recommended night lights and sensor lights and reviewed with Terry where he might purchase these items. Kate also provided Terry with a home safety brochure developed by the Centers for Disease Control and Prevention. There's also going to be a brochure like that in your workbook from today. And she talked to him to make sure that he understood the information. They talked about basic strategies to improve home safety, such as clearing clutter from the stairs and walkways, having bilateral handrails on the stairways, and adding contrast tape to the stair edges, removing throw rugs, and using non-slip mats in the kitchen and bathroom. Terry commented on how the home improvement store where he worked had a section devoted to safety in the home, and he thought it would be a good idea to install a grab bar in his shower. Kate helped Terry complete a realistic step-by-step plan to make sure he had the help he needed to get the grab bar and install it correctly. She also discussed the best location of the grab bar. Finally, given Terry's balance concerns and wrist injury, Kate suggested a handheld shower and a shower chair. Kate explained that evidence suggests that a one-size-fits-all approach to home safety will not reduce fall risks, and that each person and home should be looked at individually. So if we go back here to that picture, Terry actually does have some good looking stairs there. Those stairs have a contrast tape on them. They're whiter or maybe just plain wood. And then he has this non-slip piece on the edge, and there's definitely an edge to those stairs. So those stairs look good. And you can tell that they put in this grab bar here on the side too, but he doesn't have one on the other side. He's only got the one handrail, and he's not using the handrails. So at this point, we've heard a lot about Terry's physical and environmental risk factors, but let's consider some of his behaviors that can increase or decrease his fall risk. So before I reveal Kate's recommendations, what are alternative ways that you think Terry could have used to get that patio furniture inside without putting him at risk for a fall? I know somebody said earlier that the grab bars. Any other ideas?
Could have asked his neighbors to help him.
Yeah, he could have delegated this job, right? So he could have delegated the task to somebody else. He could have gotten help so that somebody was there with him. He could have folded that chair up to make it easier to carry down the stairs and actually use the railing on the stairs. You know, his hands are both on the chair and he's not even touching that grab bar. And the other thing is he could find a different place to store the chairs in a different location that's easier to access. So he doesn't have to bring the chairs up and down every time he has people over. Terry learned that carrying large objects while walking downstairs is something he should not attempt to do, especially since the sensation in his feet has been affected by his diabetes. But with Kate's help, he determined that he could still do other things. Terry would have had no trouble carrying a lighter folding chair down his basement stairs because he would still have one arm free to hold onto the handrail. Kate and Terry also discussed how he could get into the habit of planning ahead to make the activity easier. She explained that the key is to stop, evaluate everything involved with the activity, including the safety risks, and make a plan. So that's what here's Terry's recap there. Okay, so that's a lot of information that can be done to manage your fall risk. So let's remember these fall prevention strategies as you go. We're going to manage your chronic illnesses or conditions. This might seem like a no-brainer, but some choose to ignore their health conditions. By allowing diseases to continue without treatment, this can exacerbate your symptoms and compound your risk. Get an eye exam regularly, even if you think you have normal vision. Stay hydrated. Who knew that drinking water plays such an important part in fall prevention by avoiding postural hypotension and urinary tract infections? Slow your transitions from rest or lying to sitting and standing. Try your ankle pumps to get your blood flowing before you transition. Talk to your physician and pharmacist about medications. Stay active and exercise regularly to help maintain or improve your balance, strength, and endurance. Talk to your doctor before starting any new community-run program, and remember, many specific yoga or Tai Chi classes can be found online. Stop before an activity, consider whether or not it's safe, and make a plan that reduces your risk of a fall. Problem solve alternatives or adaptations for potentially risky behaviors, and delegate the task to someone else. Get help so you're not doing the task alone, and actually use the safety supports in place. Identify and eliminate fall hazards in the home. Have a professional assessment completed to prevent falls. Don't wait until after a fall to have this done. And finally, hire help to maintain the safety of your home if you can no longer do it, such as a caregiver, a house cleaner, or a maintenance team if you can't safely perform the task on your own. And that's about all I have for today. In closing, a thought from the great John F. Kennedy: in a time of turbulence and change, it is more true than ever that knowledge is power. I particularly like that one. And another one that's pretty powerful: if you don't take time for your wellness, you will be forced to make time for your illness.
That's a true statement right there.
Yeah, and here's just some references. And then I think Bess is going to talk to us.
Yeah, thank you so much, Melissa. That information was incredibly helpful, and I think we all appreciated your expertise on the subject and explaining some of the more technical issues of falling. So we really appreciate that. We will definitely make more of this information available to anybody that wants it. A lot of the details are included in the workbook that we can make available to you, either a digital workbook or a paper workbook. So I actually, in the link or in the chat box, you're going to find a link to a survey that we have for you guys. And we ask that you open that and fill that out while I'm kind of chatting here so that we know what information you're interested in receiving, whether it's a workbook or how we can follow up with you guys on questions that you may have and getting you some more details on this information in the future. So here at the Portland Elder Care Council, our entire goal is to provide you and your family with the resources that you need to plan for your future, make good decisions, and have all the support and help that you need moving forward. So please don't hesitate to reach out to us on our website at the Portland Elder Care Council, or if you know any of our members individually, you can definitely reach out to us individually. Also, if there's something specific that you're looking to have some education on, please note it in the survey that we've linked to. And that way we can make sure that we are creating content and answering questions that are on your minds. Also, Mariah has linked for us here to our website for next month's event. And it's actually going to be a subject presented by her, Mariah, our money guru, and it's the art of long-term care planning. So she's going to go into the details of how you can really make sure that your resources and your assets are being used appropriately so that you can have the life that you want as you continue to get older. So if you're interested in that, please link or register online. Let's see. Oh, I need to add the registration. Mariah just reminded me we need to add the registration to the website. So bear with us there. Like I said, our normal director is just left for maternity leave, so I'm figuring this all out. So bear with me. If anybody has any questions, feel free to jump out. But we will be following up with you guys on that survey and getting you the workbooks if you did request that. So any questions before we let you guys go for the evening?
Yes, I was just gonna make the comment that if you guys have been finding value in the education that we've been putting out in the workshops, our plan is to have a workshop every month on the first Thursday every month at 4 p.m. The topic will change, but if you want to just put a note in your calendar to remind yourself either to go to our website, we'll be sending follow-up emails as new events come out as well. But we do keep them at the same time and day every month, so it makes it easy for people to save that time if they like what they're hearing.
Yeah.
So our next event will be March 4th at 4 o'clock, which is the first Thursday of the month.
Wonderful. Thank you so much, Mariah. And I think unless somebody else has some other items that they want to address, I think that's everything for us. I'll be following up with you guys on the surveys, and we look forward to getting your feedback and seeing you back here next month.
And best we could probably too just hang out for a little bit because we did it
Yeah.
a little bit early in case anybody has
Anybody
any
has
questions
questions.
or they want to come off or just chat with us for a little bit. I know I can hang out.
I'm just keeping some notes here that I'm getting in the chat box too. So, and like I said, you do all have to bear with me while I'm figuring out the director thing. But great job, Melissa.
Thank you.